4 weeks ago today, I had a total shoulder replacement by Dr. Churchill at Aurora Medical Center Grafton, and I am doing amazingly. I saw Dr. Churchill about 2 months ago, and he described my shoulder as basically having zero range of motion. For the last 2.5 years, I've had a lot of pain, completely limited in my recreational activities. It's my left arm, so as far as gardening, bicycling, yoga, all the things I love to do with my family, I really couldn't do, and the pain was getting worse. Like a lot of people, I was absolutely scared to death. I've never been in the hospital, but I'd heard so many great things about Dr. Churchill. I went and met with him. He convinced me at that first appointment by the way he listened to every concern I had. He sat down, he was so compassionate, he said, "Wendy, tell me what you've heard. Tell me what you're afraid of." And then I told him everything I was concerned about. I didn't want to miss months and months of work. I didn't want to have the pain that so many people described. I thought I could live with what I had versus all the horror stories. And after spending a half an hour with him and him explaining everything, I felt completely confident that he was the right surgeon. He is a specialist. This is what he does. He explained his strategy about having the arm not in a sling except for the first 24 hours that it's down and moving, and that I would be able to return to work very soon. It would be up to me, but I told him my surgery was Tuesday. I wanted to be back to work on Monday. I love my job. I didn't want my colleagues to have to cover for me for a long time, and when I take time off, I really want to be doing things like vacationing, not laying around and recovering. He said, "Absolutely, Wendy, you can do that. You'll want to start slow." So I actually was back to work the following Monday after my surgery Tuesday. Took it slow the first couple days, but I amazed myself, but I really give all the credit to Dr. Churchill. The thing that he also did that was so amazing, besides from being so compassionate, answering every question I had and all my fears, was I talked to him about my belief in the idea of guided imagery, that if I listened to tapes to help me relax and prepare for surgery and all those positive kinds of thinking strategies, he absolutely supported. In addition to talking to Dr. Churchill, the other thing that was really important to me is I was able to talk with other patients who'd also had an amazing experience with him and had very successful outcomes, as well as just feeling great about Dr. Churchill, his bedside manner, and how he worked with them. And that was really why. My surgery was a huge success. I'm just I can do things now already in 4 weeks that I hadn't been able to do in years. I'm in the middle of my therapy, and I'm just really excited to be able to be biking and swimming and and gardening this summer that I can't believe I put off for years because I had been so afraid. And thanks to Dr. Churchill, I got a new hinge and I feel great.